So for examination of cranial nerve 1, the olfactory nerve, you can do a formal assessment using several bottles containing different aromas. But for a gross examination in the clinic setting, we here have just some coffee in a cup. And so what you can do is just cover it and slightly uncover it and ask the patient to take a sniff in through the nose. What can you smell there, Sam?
Oh, that smells like coffee.
Fantastic. So for cranial nerve 2, the optic nerve, we'll start by testing visual acuity. So we'll just do a gross test of acuity here in the clinic setting, but if you want a formal test using the Snellen chart, you can consult one of your ophthalmology colleagues. So we'll test the right eye first. So Sam, if you could just cover your left eye with your hand.
Sure.
Perfect. Can you just read that top line for me?
Clinic outcome form.
Fantastic. Now can you cover your other eye?
Yeah.
Fantastic. And can you just read that line down there for me?
Diagnosis.
Perfect. So I'll just get you to keep covering that eye for me. Now we're just going to test the visual fields.
Yeah.
So if you just keep looking straight at my nose, I want you to let me know if you can see my finger. I'm going to cover my eye as well.
Yeah. Yeah.
Fantastic.
Yeah.
Good. And now we'll swap eyes. Brilliant.
Yeah, you can see that. Yeah.
Good.
Yeah.
Brilliant. Fantastic. So now we'll just have a look at the pupils and how they respond to light. So just looking at the right eye. Good. That's normal. And then you're also looking at the opposite pupil's response. Good. Thanks, Sam. So now we'll test eye movement, so covering cranial nerves 3, 4 and 6. So it's important here to ask the patient if they're experiencing any diplopia or double vision during any of the eye movements. So Sam, I'll just get you to keep your head completely still, focus on my finger, and if you can just follow my finger with your eyes. Any double vision at all there, Sam?
No.
Good. That's okay?
Yeah, that's fine.
Good. And now just following my finger in towards you. Good. Well done. So now we'll test the 5th cranial nerve, the trigeminal nerve. So first of all, testing facial sensation, and you want to test the 3 distributions of the trigeminal nerve, the ophthalmic, maxillary and mandibular branches. So Sam, I'll just get you to close your eyes and
sure.
I'll ask you if you can feel me touching you. All right?
Yeah. Yeah, I can feel that.
And that feels the same on both sides?
Yeah, it feels the same. Yeah. Yeah. Yeah.
Good. So if you detected any abnormalities there, you could then go on to test for pain. So what we have here is a spatula that's broken down so that you have some sharp end and a blunt end. So Sam, if you just close your eyes again, and if you can tell me if you feel sharp or blunt.
Sharp. Blunt. Blunt.
And then you'd carry on down through the different distributions as well. Next we'll test the corneal reflex. So I'll just get you to remove your glasses if that's okay, Sam. And again, just with a cotton bud here. All right. So what I'm going to do is just test the outer aspect of your eye there. So I'm just going to touch your face there. And there you go, you can see he's got sensation there, he's blinking away. Well done. Thanks, Sam. Testing the corneal reflex, you're testing the afferent component, which is the trigeminal, and you're testing the efferent or motor, which is the facial nerve. So next, testing cranial nerve 7, the facial nerve. So the most sensitive method of detecting abnormality is to get the patient to blink rapidly. So Sam, if you could just blink as fast as you can for us and keep going. Great, well done. Next of all, could you raise your eyebrows for me? Great. Could you shut your eyes as tight as you can for me? Perfect. And then you can try and lift them. Can you puff out your cheeks for me? Good. And show me your teeth in a big smile. Great. So you're comparing both sides. It's a normal exam. So when you're talking about abnormalities of the facial nerve, there's a scale called the House-Brackman scale. And so it's ranked according to different abnormalities, particularly with reference to the ability to close your eye. So you can look at that scale for further reference. So we'll examine cranial nerves 9 and 10, the glossopharyngeal and vagus nerves. So what you want is 2 tongue depressors and a headlight. So Sam, I'm just going to get you to open your mouth nice and wide for me.
Yeah, sure.
Right. And so we're wanting to examine the palate. So if you just rest your tongue there and chin up slightly for me. Good. Tongue out for me. Great. So I'm just going to pop these in your mouth there, Sam. Good. So we're wanting to examine the palate, which appears to be symmetrical. And then we're going to test sensation. So Sam, can you feel me touching you there?
Uh-huh.
Good. And can you feel me touching you there?
Uh-huh.
Well done. So also in examining the glossopharyngeal nerve, you can ask the patient to take a swallow. So Sam, if you can just swallow a bit of water there for me. Fantastic. Great. And so also when you're examining the vagus nerve or the recurrent laryngeal component, you can ask the patient to speak or make certain noises to examine the voice quality. So Sam, if you can just give me an So what you're looking for there is any what we term breathiness, which is a voice quality where you're having air escape, so you're losing power from the voice quality. And so also examining the maximum phonation time. So I'm just going to get Sam to say ah for as long as he can. So Sam, you just take a deep breath in and then say ah for as long as you can, and we'll time you. Well done. So his maximum phonation time is over 9 or 10 seconds, which is normal. So we'll now move on to examine the accessory nerve. It's important to note that the glossopharyngeal, the vagus and accessory nerve all come from the jugular foramen. So lesions affecting that region can affect all of those nerves together. So examining the accessory nerve, we're first examining trapezia. So Sam, if you can just shrug your shoulders. Good. So nice, strong, symmetrical movement there. And then I'm just going to ask you to turn your face against my hand there. Good. Nice power there. And again on this side. Good. And you can also palpate and watch sternomastoid as they do that movement. With regard to examining the hypoglossal nerve or cranial nerve 12, again, a headlight's a good idea. And you ask them to open the mouth nice and wide. Good. So you're looking at the tongue at rest for any fasciculations, wasting or asymmetry. And Sam, can you poke your tongue out for me and move it from side to side? Good. And if you close your mouth for me, can you just push your tongue against the cheek there? Good. And that's good. That's a good way of assessing tongue power.